Speaking of policies and programs, Dr. Oyebanji Filani, how do you think the government and relevant stakeholders can ensure the smooth transition of public health policies and programs during periods of political changes, ensuring minimal disruptions to healthcare services?
Thank you. So I think first and foremost, you have to have very clear policies. If you want anything to be sustainable, it's always best to there's a conversation around enabling a bill or an act for that, right? So you put a legislation piece in place to ensure that it sustains it, right? Once that is done, you have to have very clear implementation pathway, right? And, define your success along the way. And once you get that, you then need to sell it, right? I'll give an example in my state. When I became commissioner in 2020, we had a central medical store, but we didn't really have a drug management agency. So you go to a number of our facilities, they'll have some commodities, then there may be no commodities in others, right? And then prices varied across facilities, right? Because they were getting them from chemists or, PPMVs just around the environment. So you couldn't guarantee the quality of commodities, you couldn't guarantee the pricing, right? And of course, it had the unintended consequence on the patient because most of them were paying out of pocket. And if they go to facility today, if it's 500 naira, tomorrow it's 550 or 650. There's the challenge is that. So what we did was to first, provide the legislative backing to set up a drug management agency. And right after that, began to put together the strategic documents and implementation plans for that. But also then connected that drug management agencies directly with what we call the manufacturers. So that allowed us to cut away all the middlemen, right? And in doing that, we were able to we locked in prices for an extended period of time. We could guarantee the quality of the commodities that were coming into the state. And also with a downtime, the forward end goal to ensure that we minimized stock out in most of our facilities. Having done all of this, you then need to communicate the success, right? Communicate it heavily, right? You communicate it to the governor, you communicate it to the House of Assembly, right? You communicate it to the traditional rulers, you communicate it to the religious rulers, you communicate it to people within the Ministry of Health, right? And all the different sectors. You communicate it during the Exco, and then you communicate it in every different engagement you go to. And you have to sell it based on what people are interested in, right? So what I will tell my governor as an example is you can be rest assured that because we're engaging directly with manufacturers, the commodities are genuine, we know, right? And we've locked in prices. What I'm going to tell the communities when I'm engaging them is if you go to the facility, you will no longer have variation in prices and you can be sure that you're getting genuine drugs. So we'll communicate accordingly and then allow the state on it, right? So you as a policymaker can give birth to the vision, you can help tend the baby, but very quickly, begin to allow the state to own it. In its first year, we did revenue of about 300 million, which is huge for, a first year drug management agency. And now about 78% of our primary healthcare facilities buy from the DMA. All our secondary care facilities buy from the DMA. Our tertiary institution also buy from the DMA. They have significant contracts, extended contracts with manufacturers who are keen to continue to supply us with commodities. So it is no longer an individual success, right? It is now a state-owned success where everybody feels like this is something that we did and we own and we can move forward. So whether Dr. Filani is there tomorrow or not, the DMA will continue to run and it will function optimally. Whether there is a change in government, right, whether a governor to governor, a commissioner to commissioner, the DMA will run and function optimally because everybody sees it as their own, right? So again, just to summarize this, ensure that you have the enabling environment from a legislative point of view is to ensure that you're clear in terms of the implementation pathway and communicating success is even in the processes, right? So don't wait till the final outcomes. You have to be clear around the communication, sell it continuously and make sure that the ownership is by the state, not as an individual. An individual can champion it, the governor can champion it, right? But you want it to be owned by the state. Otherwise, once that one person leaves, it creates a risk of, well, that's his program, I need to define my own.
Very innovative. Thank you so much for sharing that, and congratulations again to Ekiti State for this feat. It is obvious that some assessment went in when you became commissioner to understand the problem so that you could then design a solution to target it, which is how you achieved this. How can we promote more of this research in government so that decisions are evidence-based?
So it's a good question. I mean, if you zoom out and look historically at the sort of like commissioners that have been appointed over the last 15 years, you see that there's been a shift and the type of people who are becoming commissioners. And I say this with extreme respect to those who came before us, is more often than not, you'd have, say, a clinician become the commissioner. In about 10 years ago, I was doing a resource tracking study with a senior friend, a Brazilian, health systems background, not a doctor, and we'd gone to the hospital, we had some discussions, and when we left, he smiled because the doctor was a bit aggressive and said, look, if it's clinic, of course he knows everything more than I do, but on a health system, he doesn't have any idea what we're talking about, right? So if you bring no matter how good a clinician is, if you bring him or her in, there's a long lane curve, right, for you to understand how the system works. I typically look at the role of the commissioner in any of those roles. You have the technical, and with all due respect, you can buy that off the shelf, right? So you get a good assistant, you're fine. You have the administrative, and then you have the political. So there's a lot of work that needs to be done. Now, so back to the point I was making in terms of the sort of commissioners we have now, we're seeing a significant shift in people who have health systems background. My colleague in Yobe, for instance, has very solid health system background. My colleague in Gombe has over 20 years working with WHO. My colleague who just left Kaduna had over 15 years in UNICEF. So you're seeing people who already understand health system and recognize that the intra engagement across the different agencies, whether it's SPHCDA, whether it's insurance, whether it's drug management agency, whether it's HMB, all of it, right? And bringing that coordination to bear, right? So that's one, right, is the leadership count. The second then is, recognizing, once the leadership then recognizes the need to use data for decision making, then becomes easier to engage. And we're very hard on that in Ekiti State. At the level of the Nigerian Health Commissioners Forum as well, which I chair, it is something that we're very curious about, is what exactly is the data saying? We're having a side conversation just earlier on talking about family planning, and some of the things we talked about is, look, forget the conversation around family plan. Let's meet the need. The need is huge, right? But if you don't know the need, because you don't know that you don't have access to the data, you can't then make any decision. It has implication on how you plan. It has implication on how much you fund, right? And it has implication on health outcomes, right? So people may be focusing on, our biggest issue in Nigeria is, think of any surgery as an example, right? Say maybe just even a neuropathy, right? But then the data suggests that it's malaria as an example, right? So that's focus on data. At the Nigerian Health Commissioners Forum, we're very aggressive about it. We're encouraging our colleagues to continue to look into what the data says. And that data is across board. There's administrative data at the facility level. There's survey data from the NDHS or any of the other players. There's even the anecdotal data that begins to give you some sense as to what is going on. So if you spend some time visiting the facilities, understanding the nuances across facilities helps you to do that. Once you also begin to publish them more, it encourages others as well. So there's a nice rivalry competition amongst commissioners, like, what is he doing in Enugu? Let me see, I can quickly, she shouldn't be better than me. You don't say it out, but she shouldn't be better than me, So if you, and it's self-sustaining, right? It's a positive feedback loop. Everybody continues to do that, and then we'll continue to churn it out. I'll use this opportunity as well to also encourage a number of organizations. Sydani as an example, IHP, we talked about this, right? Is I know government can be tricky, right? If you have the data, like, no, don't publish it because it's not good, or don't publish it yet because we want it. But there are nuances around how you present your policy briefs, even if they don't come out as, published paper, right? So this works well, this is what we can learn. People will be fine with that. Not everything is Nigeria underperforms in the health sector. People are, we've been talking about this thing for 15, 20 years, right? So guys get jaded on it, right? But this works well, we're seeing this is where things can be better, right? So if we change the narrative around how the data is presented, how the policy briefs comes out, then people are more interested to say, okay, what does that say and how can I utilize it?
Yes, please, a round of applause for him. You're very spot on that end, and you're also